Hello, doctors. So now I'm going to talk about the sepsis station. In sepsis simman station, the patient is confused because of the underlying sepsis, and sepsis is because of some infection. Now, infection can be urinary tract infection, or it can be pneumonia. Okay, and that you will find out while doing A, B, C, D, E. Okay, but as soon as you enter the station and you look at the monitor, you will find out the oxygen saturation is low, respiratory rate is high, and blood pressure is also low. The temperature will be about 38.5 easily. Okay. So as you go near the patient and you introduce yourself and you confirm the patient name, the patient will be confused. Okay. They will be grunting, uttering morning sounds, and like his GCS will be low overall. Okay. So if he is not able to confirm his name, then you need to check his wristband to confirm his name and age before proceeding. Okay. So as oxygen saturation of this patient is low, you are going to do the A part. You are going to check his airway, and you are going to start the patient on 100% oxygen, 15 liter per minute when on with the mask after confirming smoker's cough. Okay. After that, you move on to the B part. You will tell the patient that I'm going to have a look at your chest, please. You're going to expose the chest. You're going to do inspection, palpation, percussion, and auscultation. Now, if this is because of pneumonia, then while doing auscultation, you will find out that there are aerial sounds and there are crackles in the chest. Okay. All right. After that, you are going to move towards the circulation part. You are going to check the capillaries. Capillaries will be cold. You are going to check the capillary refill time. Capillary refill time will be more than 2 seconds. Okay. Then you will move towards radial pulse. You will check the radial pulse. You will look at the monitor and you will verbalize that the pulse is on the higher side. You will request for a fresh blood pressure finding. You will look at the monitor. The monitor will give you blood pressure that is low, well below 90/60. Okay. So what you are going to do, you are going to start the patient on IV fluids. This blood pressure is low and pulse rate is high. So you're going to verbalize my patient's blood pressure is on the lower side and pulse rate is high. So I'm going to start my patient on normal saline, 500 ml of normal saline over 15 minutes. Okay. So for that purpose, I need IV access. So I'm going to pass to large bore IV cannulas, 16 gauge. Okay. So you'll go to the medicine part. You'll pick coffee colored cannulas or gray colored cannulas, and you will pick normal saline. You will put it on the IV stain and you will pretend that you have started the patient on IV fluids. Okay. All right. At the same time, you will also verbalize your investigation. So you'll say, I'm going to send some investigations, some blood tests for my patient that include complete blood count, urine electrolyte, liver function tests, serum lactate, clotting profile, blood culture, and I'm also going to request for a chest X-ray and ABGs. Okay, so you will request all these investigations: chest X-ray, ABGs, CBC, urine electrolyte, LFTs, serum lactate, blood culture, and inflammatory markers as well. Okay, so remember all these investigations that we are going to verbalize there just to cover everything. Okay, now if this is a sepsis patient, there will be leukocytosis and serum lactate levels will be high. Okay, so serum lactate level about 2 are considered high. Serum lactate level that are 4 or above are serious and needs ITU transfer. Okay. All right. So examiner will give you these findings. Okay, and then you will move toward the disability part. You will check the blood glucose level. You will check pupillary light reaction, and you will ask the patient to if he can raise his right hand. Okay. After that, you will go towards the exposure part. All right, so you tell the patient that now I'm going to expose you further just to look for any abnormality. Now, if this is because of a urinary tract infection, you will find out that you'll find out that there's a catheter, there's urinary bag attached to it, and urine bag is containing urine which has changed its color. It is like brownish color or muddy. Okay, so when you find out the patient is catheterized, you need to trace the catheter to the urine bag, and you need to actually look at the urine bag to see whether the catheter is whether the urine bag contain dirty colored urine. And when you find out that the urine is dirty color, you're going to ask the patient since when has he been catheterized. Okay, so if the patient say, I've been catheterized for the last 1 year, there is a patient with any urogenic condition that is long-term require long-term catheterization, then you need to ask, is this catheter for the last 1 year? And he will say, no, it is for the last 2 weeks or something. Okay, so you are going to ask any problem with urination, any burning urination, any pain on urination. Okay. Also in the exposure bath, you are going to check his abdomen, and you are going to do inspection, superficial palpation, and deep palpation. And when you are going to do palpation, you are going to tell the patient that I'm going to touch your tummy. If you feel any pain, just let me know and I will stop. Okay. So when you are going to do palpation, you find out that in the suprapubic area there is tenderness. All right. So what you have done until now, you have given the patient oxygen, you have given the patient fluids, and you have taken a blood for investigation. So now, if you find out that there is a urine catheter in place and the urine is dirty color, you are going to verbalize that I'm going to change this catheter, and I'm going to send urine for culture, okay? And I'm going to monitor the urine output of the patient. Right, and you are going to look at the monitor again, and you will be looking for the blood pressure and the pulse rate. If the blood pressure is still low, then you will verbalize that I'm going to continue the patient on IV fluids. Seems like the patient has some infection going on, so I'm going to give my patient IV antibiotics according to the hospital protocol. And if the temperature is high, then you also verbalize that I'm going to give my patient IV paracetamol. Okay. All right. So where is your simman patient? The sepsis simman station. One more thing in the sepsis station is the patient is confused. He will be asking you again and again, doctor, where am I? Doctor, what is happening to me? So even if the patient asks for the 20th time, the doctor, where am I? You are going to answer as politely as for the first time that you are in the hospital. I am here to help. Okay. And if the patient says that, doctor, what is happening to me? He's not necessarily asking for a diagnosis. Okay. He's confused. He is asking for reassurance. You are going to reassure him that, Mr. Smith, you are in the hospital. It seems like you have some infection going on. Or if you are in the circulation stage and you are not yet aware that you are not even sure that it's infection, you can just tell him that, Mr. Smith, it seems like your blood pressure is on the lower side. I'm here to help you. Okay. The patient is not asking for diagnosis. He's asking for reassurance. And this is where your IPS comes into play. Okay. So I hope this sepsis simman is clear. As you, all of you might remember, for the Lab 1 preparation, that in sepsis we need to give 3 and take 3. So if you focus on the station, we have like covered all the give 3 and the take 3. So in give 3 we give oxygen, we give fluids, and we give antibiotics. And the start right from the start of the station, we start the patient on oxygen. Okay, we give fluids when we find out that the blood pressure is low. All right, and then when we find out that the temperature is high, and we find that there are some critical congestion or there is dirty urine bag, we start the patient on IV antibiotics. And take 3 includes taking blood, which we took in the C part. Okay, and taking serum lactate levels, which we also took in the circulation part, and taking urine for culture, which we also did. Okay, so this give 3 and take 3 cover your station. Just remember to be very, very reassuring in the station and continuously answer the patient queries, the doctor, where am I, what is happening to me, and stuff like that. So that is your sepsis simman station.